Face, head, and neck swelling can be caused by something like a plastic surgery, or can be something like lymphedema, which is caused by cancer surgery, radiation, or even genetics. If someone has had a plastic surgery, usually the swelling will go down between 4 and 12 weeks. If someone has lymphedema, that's usually lifelong and chronic in nature. But how do we manage the swelling in the face, head, neck area? Well, my name is Kelly and I am a physical therapist and I specialize in lymphedema, oncology, and women's health. So in this video, I'm going to go through the 4 main treatment options for face, head, and neck swelling. So as I explain these 4 options, just remember that although I am a physical therapist, I'm not your physical therapist. So make sure that you talk to your doctor or your medical team for more personalized treatment. So the first treatment option I'm going to talk about is the most simple. It is elevation. Gravity does make a difference for swelling. And so when we think about swelling in the legs, those individuals will usually have more swelling by the end of the day because gravity has played a role pulling the swelling down. Versus the morning, it's going to be a little bit better because their legs have been up all night, equal with their heart. Now when it comes to the face, head, neck area, it's the opposite. So if you think about it throughout the day, you're more upright, and so gravity is going to bring that swelling back down towards the heart. Versus at night, when you're laying on your side, you're not as upright, gravity is not going to help you as much, and so there's going to be more swelling throughout the night, and individuals with head and neck lymphedema or face swelling do notice more issues when they first wake up. So how do we help with this? You want to elevate the head of the bed area. A lot of beds nowadays have the option for you to raise the head of the bed. That is going to be great. But if you have a standard mattress, you want to try getting a lot of pillows, or even better would be getting a wedge pillow that is angled to help prop you up, and so that throughout the night you're getting a lot more of that drainage out of the area. There are a couple different great options out there. I will place some links down below that you can check out further. The next way someone can decrease the swelling in their face, head, neck area is with lymphatic drainage or lymphatic massage. Lymphatic drainage massage is a gentle technique that helps guide the fluid out of an area that's congested to clear the fluid out and decrease the swelling. Lymphatic drainage massage is done in a specific sequence because we know where the lymph nodes and the lymph vessels are. And so when we're talking about the head, neck, and face area, we're going to look at the base of the neck. You have lymph nodes here around your collarbone or your clavicle, and you also have a lot of lymph nodes that are right below your ear. You also have some lymph nodes underneath your jaw and throughout your face as well, but these are where the bulk of them are. And so all we'll do is use our whole hand, and you can do small circles right over where those lymph nodes are. You don't have to press really hard, you want to be gentle, but doing 8 to 10 circles in one area, and then you can do 8 to 10 circles in the other area. That can just help stimulate the lymph nodes, and sometimes that's enough to get just fluid moving a little bit quicker out of that area. But from there, we can also guide the fluid down. And so the lymph vessels run from the lymph nodes below the ear to the lymph nodes around your collarbone or the base of your neck. And so all we'll do is down the side of your neck is gently guide the fluid down, doing about 8 to 10 strokes there, or however much time you want to spend. From there, if we have swelling in the face, we know the lymph vessels run from the middle of your face outwards towards the base of your ear, the bottom of your ear. So then if you have swelling in the jaw area or around the nose or under the eyes, we want to just gently guide the fluid outwards towards the base of the ear. So if you've had a surgery, especially around the nose area, and you have a lot of swelling around here, all we're going to do is gently guide the fluid outwards, everything going towards the base of the ear. So you can spend a few minutes in that area or whatever you need to. You can also do the forehead or again, whatever you may need. Once you get everything to the base of the ear, you're just going to finish one more time down the side of the neck just to make sure that you're clearing it out of that head and neck area. Now I know that was really quick, but if you want a more in-depth video that you can follow along with, I have created a video on head and neck lymphatic drainage, and I will place a link for that up above or down below. So the third thing we're going to talk about is compression. Compression is the most common way to manage swelling anywhere in the body. Just think about compression stockings. Now, when you think about compression for the head neck area, yes, it is more challenging. This will vary from person to person, so you want to make sure that you're working with your lymphedema therapist for personal guidance, but in general, most people will wear some sort of compression at nighttime only. This is for two reasons. One, because the nighttime, like we talked about, is the most common time for someone's swelling to go up because of the gravity component, but also so they don't have to wear compression during the daytime as they're out in public. So there are a lot of different brands and types and amount of compression out there. This is one of the most basics. This is more of a jaw compression for someone who has swelling around their neck and jaw. It goes up over the back of the head and straps around the neck. It's going to be a little bit thinner of a liner, but it's going to give some gentle support, especially for someone right after surgery. This is a great option. Now, if someone has more fibrotic tissue, which is that thickening of tissue, usually caused by scar tissue, radiation fibrosis, or even from the lymphedema fibrosis, then we can add something underneath, like a swell spot, which is going to be this gentle, soft pillow that pushes against the face, head, neck area for a little bit more compression, but it is pretty light and pretty soft to use. There are different types and sizes of swell spots that someone can get based on what kind of compression they need and where their swelling is. They also have mandible or jaw pieces that are shaped for the jaw. They have some for even around the eyes for anyone who has swelling around the eyes, and they also have ones that are for the full face. They do also make mandible pieces with straps, so if you have swelling just specifically under the jaw or under your chin, that can go under the chin, give some nice compression, and then you have the straps overhead to hold that in place. So you're looking at just the basic straps or one that holds kind of the whole area in place as well. So I will place some links down below for all of these, and you can check them out a little bit further and see what may work well for you, or for a therapist, see what may work well for your patients. Not only is the compression garment or compression swell spot going to help decrease someone's swelling and reduce their fibrosis, but it's also going to help avoid swelling from increasing. Now, if you just had a surgery and you're looking to get your swelling down, you can also take this compression piece that fits around your face, and you can take your small ice packs and put them inside. So it's a really great option to hold your ice packs in place, and then you don't have to sit there and hold them yourself. The last thing we're going to talk about today is exercise. The muscle acts as a pump to the lymphatic system. So when you use your muscles and they're activating, that's going to squeeze around the lymphatic vessels to help get the fluid moving out. And so by moving your head and neck in different directions, or even opening up your mouth wide and closing, same thing with your eyes, opening and closing, that's going to pump the muscles in the area, and that can help get the fluid moving through. Other general exercise such as walking, swimming, biking, or any other activities are all also going to help the lymphatic system to assist the fluid moving out. There are other ways to manage your swelling and lymphedema, but these are the main 4 ways. Your physical therapist or certified lymphedema therapist may have other ideas or guidance for you for your personal needs. So make sure you check out with them if you have any specific questions. Thanks, everyone.